improve the public health care, you need 2 or 3 major quick actions. Number one is the issue of general public enlightenment. Up till today, in our rural areas, there is a lot of need for public enlightenment. Secondly, we must go back to the primary duty, the primary healthcare level. Unfortunately, most of our tertiary hospitals, the teaching hospitals, have no business with small ailments. They have been reduced to primary hospitals because of the absence of the primary level of healthcare provision. Otherwise, the teaching hospitals, the general hospitals have no business with small cases of immunization, for example. So what we need to do is to go back to the root, go back to the local level, join hands together with the local governments, with the state governments. Of course, they are independent. If I become the president tomorrow, I am not going to dictate, but I will create a situation whereby we'll discuss with the local government authorities, with the state authorities, to initiate some understanding of public. We give the lead for them to pump in more resources in providing primary healthcare services and general enlightenment. This will bring up the level. Then the state government will concentrate on the general hospitals. Just as I've done in my state today, we have tried to create more of the primary healthcare centers. We are concentrating on general hospital and building a new one, and we are creating a new pediatric hospital of over 3 billion naira, the first of its kind in Nigeria today.
I'm sure you will agree that immunization of children is very central to the health, the public health. And yet, under your watch in Kano State, you stopped the polio immunization program.
I know you're coming to that.
And yes, and many children.
Well, I think a very quick explanation to that. You see, when we came on board in 2003, we had an assessment and we discovered that the entire primary health care of the state was collapsing. It's not just about the polio, all other diseases, up to the point of everybody in the villages rejecting every other vaccine on the fear that because they had been indoctrinated wrongly, that the vaccine was
I think this particular question is important, but I'm getting, so I'm going to actually just let it ride. Just to explain to the audience, we'll try and make it up to the other candidates in other questions. So please carry on.
Thank you. Oh, I continue?
Yes.
So when I came, we discovered that all these health services were breaking down. It went to the point that even the rural water supply, they went to the villages to do chlorination of the local wells. The people chased them away, that they have refused the children to give them the vaccine of polio. They are coming to drop it in the well. So what we did was we said, okay, if it is the polio that is giving you problem, let us sift it out. We address the problem. This is polio. Please, let's keep it aside. Accept all the other services. Then we address the polio, because unfortunately...
That took a long time, and in the process, children were dying.
We were not standing still. I set up a professional committee, and we were investigating, and we charged the committee to come up with a satisfactory explanation. I didn't believe the vaccine was contaminated, but the general public have been given that wrong impression, and I have a moral responsibility as a leader. Even if it is one person in my state out of the 12, 13 million people I have that question a service, I have a duty to pose and find an answer to that question he's asking. In the end, quickly.
I'm afraid I'm going to have to stop you because I must give other people a chance. I'm sure you understand. Thank you.
Thank you
very much. Yes, thank you. General Muhammadu Buhari, what are your plans for Nigeria's health sector? Are they different from what Malam Shekara has said, and if so, how? Or are they very similar, and if so, could you explain them, please?
I think we have start by improving the infrastructure itself. For example, water supply, the waterborne diseases, cholera, typhoid, and other diseases, basically waterborne diseases. Boreholes, clean water, or deep open wells are the answer to this. But where people were forced to pick water from the stream and drink, we have all sorts of waterborne diseases that are very prevalent in the rural areas. We have to invest much more in health by building more infrastructure because of the increase in the population, then training people, then equipping the hospitals, then getting potent drugs. There are too much fake drugs in the market. and that has to be controlled. So it is very important for the healthcare, for all the three tiers of government to make bigger investment, and especially for the federal government to control fake drugs coming into the country, because that is causing more health problems than we are getting when there is so much control about drugs coming into the country. So drug control, put more investment in infrastructure, training more people, and most importantly, education. When people are educated, they can look after themselves. So we believe a lot more money should be spent in education.
Now, one of the biggest health crisis that we have in Nigeria actually is related to childbirth. A disproportionate amount of women die during childbirth, and also children die when they're still in their infancy. I'd like you to tell me how you would tackle those specific problems.
Here we have to work with foreign NGOs. They have programs of helping our people. The peculiar thing is that Nigeria, we are not all that poor. We have resources. We have to do something.
I think I'm going to let him finish. Thank you. Thank you very much, yes.
We have to make sure we look for help from foreign countries in terms of advisors, in terms of experienced medical personnel, in terms of helping to put in place pharmaceutical companies so that we can produce drugs. About children, I think governments in all the three tiers of government must make sufficient concession or allotment in their budgets to make sure that women are looked after, children are looked after, the aged are looked after. Our social services, education and healthcare, are really not being looked after by the budgets or the implementation. Money are voted, but the services are missing. The most important thing in the center, there must be control, there must be strict supervision about the health care of children and women especially.
Thank you very much, General Muhammad Buhari. Now, Malam Nuribadu, Lagos State, which is a state controlled by the Action Congress of Nigeria, as we speak, doctors are on strike, nurses are on strike, because they're not very happy with their conditions of service. Is this an indication of an ASEAN government at the federal level, how it will deal with issues of health for Nigerians, or is this an anomaly and you actually have a better plan for the federation?
Well, it is an indication of democracy in working. Lagos State is a bad example for you to give because it's the best state performing state in Nigeria today.
Not as far as people who are sick and sitting in hospital and cannot see a doctor right now. They wouldn't agree with you.
I visited a patient in Lagos State Hospital, Ikeja, and what I found there was amazing, incredible. I thought I was not in Nigeria because the modern equipment that I saw there, the quality of the infrastructure was first class, world class, and I called Fashola and I congratulated him for that. I believe issue of industrial disputes are issues that you will not avoid when you are in government. Ability for you to address it, come up with a solution is what matters. I believe they are going to solve their own problem.